So I wanted to present this case study. This is a 47-year-old female, and she presented with depression, bipolar disorder, anxiety, irritability, panic disorder, ADHD, insomnia, carbohydrate cravings, irritable bowel syndrome, and daytime sleepiness. And this is just a part of her symptoms, and she also had difficulty with concentrating, balancing, thinking, judgment, and memory. She also had GERD and reflux and nausea. This is not uncommon to see patients like this presenting in my office, and I'm sure in your offices as well. Her background is she's married with 2 children, and she really describes her only stress is not feeling well. And she feels like she just is not being a good mother because of her illness. Her husband came in for the appointment with her, which I really recommend for most of my patients, because as they're having difficulty with focusing and memory, sometimes having another person with them is very helpful. And her husband is very supportive, and he was at the appointment and has come to all of her appointments. Now, she was already on these medications when she came to me, and you can see, the Lexapro and Depakote, Adderall, Klonopin, Ambien, and she also had some high cholesterol and hypertension. So this is a heavily medicated individual. So, of course, I started out with the HPA test from Sanesco. I also did some food allergy testing, the GI, fatty acid testing, and chemistry panel. Her HPA results showed a high GABA, which can cause anxiety and patients feeling really out of balance, and it's as important as the low GABA. She also had high dopamine, which could have been, from the Adderall, and she had low cortisol. But to begin to get her in balance, I didn't take her off her pharmaceutical agents, but I began to support her serotonin with some Prolent and Lentra for the GABA function to also help her with the anxiety. She was given Somni TR for sleep, and she had Tranquilint available for her acute anxiety relief. She did have multiple food sensitivities, and so the therapy there was just to avoid the foods. She had some nutritional counseling, and she was using an anti-inflammatory medical food. Her GI test showed negative for H. pylori, but positive for Saccharomyces. So she's treated with an antifungal and, again, treated with the nutritional counseling. The fatty acid test, and I used the Johns Hopkins test, showed her high in saturated fats. She had significant demyelination. She was actually high in omega-6s and low normal in the omega-3s. And this is very unusual because 80% of the tests done at Johns Hopkins University tends to show the reverse. It shows high omega-3s and low omega-6s. And perhaps that's because of a targeted audience of patients their labs being sent there to really determine what their fatty acids are based on symptoms and neurological disorders. However, hers was just the opposite. So she was treated with the EPA DHA, and of course DHA is really important for brain function. And then she was given nutritional counseling and some IV therapies. Her chemistry panel was within the normal limits, except she had a low vitamin D. So she was treated for that. But when she came, her past chemistry panel was also normal. And she said, I've been to the physicians. I have told them how I feel, and the tests all come back normal. And I know I'm not well, and, can you help me? So the follow-up is that the patient's symptom score went from 98 to 24 in 2 months. She then discontinued her antacids when she'd been off the foods, and she'd been on an anti-inflammatory medical food for a while. She had also, on her own, discontinued the Adderall and the Lipitor, and she was tapering herself off the Lexapro. without, my advice, but she was doing extremely well. Her symptoms were significantly improved with less depression. She had very little anxiety, and she was sleeping better, and she had less fatigue. Previous to coming to me, she would bring her children to school and go home to bed and was really almost bedridden because she absolutely had no energy. And her GERD, reflux, and nausea were gone. Her IBS was resolved. And mentally, she describes her brain function and just is being so much better, and her brain fog is actually clearing. And best of all, according to her, she's a much better mother. So these are the results that I see in our practice. And in review, then, I would highly recommend the comprehensive assessment, testing, treating the person as an individual. And good nutrition is an important component because you just can't treat patients with just supplements or IVs. Good nutritional counseling, that is a real important part, as well as a very, very strong component is the targeted nutrient therapies. And then, of course, balance the omega-3s and omega-6, and then just watch your patient get well.